Alcohol and substance use disorders are growing problems across the globe, particularly so because they've started invading many households across the strata of the population, and also because the age of initiation for any substance is now dropping down. Hello friends, I Dr. Sameer Malhotra, working as a Director for Mental Health and Behavioural Sciences, Max Group of Hospitals at Saket and Panchsheel, would be talking about issues related to substance use and alcohol use disorders. Substance abuse would mean persistence of the use of a substance despite evidence of harm, particularly in the area of social and legal domain, interpersonal relationships, where you continue to use the substance despite not being able to perform due to the use of the substance. There are interpersonal conflicts and problems. The person can land up in legal trouble. Addiction is a term which we usually do not use these days, but for a common man to understand, it means a severe form of dependence. Substance dependence would mean tolerance and withdrawal, when these two concepts are envisaged within the broad rubric of dependence. Tolerance would mean you continue to increase the quantum of the substance use to get the same effect that initially a small amount of the substance would bring in. What withdrawal would mean that you have physical or emotional discomfort on missing the use of a substance, in the absence of a substance. So as a result, there is a persistent craving to use the substance to keep you in that level of high that you intend to. As a result, the person tends to neglect other priorities, other fun moments of life, and his or her life revolves around being able to gather the substance of abuse and to use it by hook or by crook. There are multiple risk factors to substance abuse disorders. One is the age of adolescence, which is the age of experimentation. The other is certain children have high risk-taking tendencies. They are the ones who have either attention deficit hyperactivity disorder, or there's a lot of domestic violence at home, and there's a lot of discord that they see in their environment. At times they are not that focused and they lack a sense of purpose and goal in their life. As a result, easy time and easy money also fuels such problems amongst children. As a part of their conduct problem, they tend to experiment and get into this world of drug abuse. A lot also depends on the type of the substance which is being used. For example, if one is starting with alcohol use, you don't get hooked onto alcohol on the very first day of consuming it. Whereas when we talk about smoking, in a couple of days, in a couple of weeks, people tend to become dependent on smoking. Similarly, when we talk about heroin, within 3-4 days of initiation, people tend to become dependent on such kind of substances. So a lot also depends on the type of substance that the person is getting into. Smoking is at times considered to be a gateway drug. Tobacco is considered to be a gateway drug to other substances of abuse. So that's the reason why it's very important for us to understand the relevance of preventing from a person getting into this world of substance misuse or abuse or dependence. When we talk about the broad treatment options available to an individual, one is about detoxification. In detoxification, we stop the usage of the substance that the person has been using. So whether it's alcohol, whether it's heroin, whether it's cannabis, we stop that usage of a substance in a controlled environment. And therein, we try to take care of the withdrawal symptoms that the person is likely to go through during that phase, so that that period of 7 days to 10 days is less painful, less distressing through use of certain medicines, wherein the person is able to kick the habit. Coming to the second protocol, we talk about harm minimization, demand reduction. In this protocol, we generally talk about patients who are hooked on to injectable drug use or perhaps to strong opiates. Therein, there are certain medications which are given to the patient so that demand for that particular substance is somewhat met and the withdrawal symptoms are somewhat taken care of. But then the person has to be on that particular regime for a while till the person is prepared for a proper detoxification and relapse prevention strategy. The third is about the issue of not just quitting the substance, it's about maintaining that state as long as possible, maybe for life. It's often said in the field of substance use treatment that it's easier to quit, it's difficult to maintain that level of motivation over a period of time. And that's wherein the role of your lifestyle, role of healthy hobbies, role of environment and family, role of social support systems, role of organizations like Alcoholics Anonymous, Narcotics Anonymous, all this steps in. And it's very, very important that we treat not only the illness, we treat the individual in his or her family context, so that the effects, the positive effects are long lasting, and we are able to revive not only the individual but the family for good. So friends, life is very, very precious. You must respect yourself, you must respect your family, and you must take any difficulty in life as a challenge and an opportunity to improvise yourself. Focus on positives that you have and positives which are happening around you, and don't shy away from timely recognizing, accepting and motivating yourself to get yourself treated out of this menace of substance use disorder. Dear friends, I hope you found this video informative. For any comments or queries, please don't hesitate to mention in the comment box below. Thank you.